I'm Fred Thompson, and I'm inside business. Nowhere is the value of technology greater than in the medical arena, where every advance has the potential to better or save human lives. Let's peer into the future with some cutting-edge developments in medical technology.
53-year-old John Villano remembers a day not too long ago when he could go bowling or play softball on the weekends. Then it happened. In 1993, at the age of 36, John started experiencing chest pain at the bowling alley and collapsed. He was having a heart attack. Stents, angioplasty, medication, even open heart surgery. John had been through it all. Then John's cardiologist told him about EECP.
Well, I never heard of EECP before, but after 4 heart attacks, triple bypass surgery, and numerous stents, I figured I might as well give it a try. I really didn't want to be cracked open again.
Within weeks of receiving the treatment, John's angina was gone. Clinical trials indicate John's case is not atypical, at least not in terms of the results.
My angina was terrible. I could hardly breathe. Forget about exercising. I couldn't even walk up my driveway.
Angina is a symptom of coronary artery disease, which is caused by a lack of blood flow to a segment of the muscle of the heart. This is manifest by either chest pain or chest discomfort, shortness of breath, or fatigue upon stress or exertion. EECP increases the blood flow to the heart.
In 1995, the FDA granted New York medical device manufacturer Vasomedical clearance to market EECP in the U.S. 4 years later, Medicare extended coverage to include the therapy. Today, EECP therapy is offered at hundreds of physicians' offices, clinics, and leading medical centers, including the Mayo Clinic, Cleveland Clinic, Duke University, and many more.
EECP consists of 3 sets of cuffs wrapped around the lower limbs and the buttocks of the patient. It is triggered by ECG, which is the heartbeat. During the diastole, which is the relaxation phase of the heart, the sequential inflation of the cuffs results in increase in blood flow to the heart and the coronary arteries. During systole, which is the contraction phase of the heart, the simultaneous deflation of the cuffs results in systolic unloading, thereby significantly reduce the workload of the heart. The clinical safety and efficacy of EECP therapy has been well documented in hundreds of peer-reviewed publications. Findings consistently show a success rate of 75 to 80%.
The hour-long treatments are conducted daily for a period of 7 weeks on an outpatient basis. The full regimen consists of 35 treatments over the course of 7 weeks.
EECP is safe, non-invasive, is effective in improving the quality of life of patients with congestive heart failure and angina, has been proven to last up to 5 years after therapy, and is covered by Medicare and most third-party payers.
EECP should no longer be considered as a last treatment option. We researchers believe that in certain stable coronary artery disease patients, it should be used first along with medication prior to any other interventional procedures.
How are you doing?
EECP is also less expensive than other treatment options. The clinical studies show that EECP reduces the emergency room visits and hospitalizations, which in turn reduces the healthcare cost.
I had EECP back in 2004, and I'm still enjoying its benefits today.
I am grateful for the treatment. I wish I'd heard of it earlier. EECP was able to give me my life back.
Patients should be asking their physicians about EECP therapy.